Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast, episode 131. This is about improving organ performance for immune organs of the tonsils and the appendix. Now, this is a little bit different of a conversation because, first of all, there's a common misunderstanding that tonsils and appendix don't matter. But even if you have your tonsils and appendix removed, you really still need to listen to this. As we delve into the podcast, I want to remind you that while I am a medical professional, the information shared here is intended for educational purposes only. It is not a substitute for personalized medical advice. Please consult with your healthcare provider for guidance on your specific healthcare needs. Now let's embark on this journey of health education together. So these are sometimes the most fun conversations that I have in my office because people are like, oh yeah, I had my tonsils out, so I don't have to hear about that. Well, it's not really your inherent design, so we actually have to talk about that even more because organ removal does not mean that your need for that organ went away. And a lot of times people say, well, they were really infected, and I get that, particularly with appendicitis, right? There is no arguing whatsoever that having surgery for an inflamed appendix is not a critical need, okay? So let me rephrase that. Appendix, if it's inflamed or it has a very severe and acute infection, it needs to be removed. Now, that being said, by convention, several doctors will go in, and if they're removing in a hysterectomy, the uterus or an ovary or both ovaries, they'll say, well, we'll just take the appendix just in case. And that is a questionable idea, quite honestly, because the appendix didn't do anything wrong. It didn't do anything to you. And it's not a vestigial, right? It's not a vestigial organ, which means it's just kind of left over. So the idea of a vestigial part of the body, right? It's, appendix is seen that way. Tonsils are seen that way. Tailbone, because it kind of curls and tucks and we don't have a tail as humans. But vestigial organs and structures in the body, I think, are not true. Okay, because I think it's just our lack of understanding of their value. And that's why I'm really excited to dive into tonsils and appendix, because you need to know about them. And I've already said that, but I really mean it. Okay, so let's talk about the appendix first, because I feel like that is really important. Because first of all, the appendix has a very important role. I call both the appendix and the tonsils bouncers, right? So if you think about going into an establishment and there is someone there who serves as a bouncer, their primary directive is to keep things calm or make them calm. And also, that includes defense of the area. Now, it's a very physical structure, a bouncer, right? And it also can be overwhelmed. So those are important things to remember. But then it still has a lot of value, right? It's not worth getting rid of the bouncer at the front of the establishment just because there was an invasion or a problem, right? You oftentimes want to figure out actually how to make that bouncer or that first line defense stronger. Okay, so putting some concepts out there as a different approach to how most people, again, understand tonsils and appendix. Oftentimes surgeons have some fun little sayings and, when in doubt, cut it out. And I think that definitely speaks to the gynecologist when they are doing an appendectomy, just because the appendix is right there and they're already in the abdomen. Or if you're, having some kind of surgical procedure of the abdomen or the pelvis inside the abdominal cavity, then sometimes the idea is just to remove that appendix. Okay, so I've kind of said that a few times, but again, the appendix is, it's a very important organ. It is designed to protect the small intestine. So if you're thinking about, oh, small intestine, maybe that has something to do with SIBO, you are correct. Small intestine bacterial overgrowth, right? So often seen as a very difficult thing to fix. And that's true because, again, the small intestine does not like to have a lot of bacteria. It likes to have very minimal bacteria. And that is compared to the large intestine, which loves to have bacteria, has tons of different strains, aerobic, anaerobic. Anyway, there's tons of stuff in the colon. It's a big party. The small intestine, it's a library, right? Few things going on, very calm, very serene, not bloating. So the appendix protects between the large intestine and the small intestine. And also you have an ileocecal valve in there. But all these things show us structurally how important it is to keep the small intestine having a one-way street to the large intestine. And right there is your bouncer at that establishment, which is the appendix. Okay, so if you have some dysbiosis, some gastrointestinal stuff, then the appendix is very important to consider. I do also have a class on 9 techniques to support the appendix and the small intestine for things you can do that are non-pharmacologic, non-supplemental, like non-supplement vitamins. But these are really good techniques to keep protecting the appendix, keep activating it, and keep supporting intestinal health. All right, so if someone has a very bad stomach, they will go to the emergency room, and then there will be imaging that's done in the emergency room after the patient is kind of poked and prodded in the lower right quadrant. Now, not everyone has the appendix in exactly the same place, but the appendix is located from the hip bone on the right side, and the other boundary is the umbilicus or the belly button. And if you draw a line there, that is where the appendix exists for most people, is within that line. And then you can press on it. You could press on it right now if you're laying down, and you could feel if that's tender. And if it is, that might be a reason for why you don't feel good, because the appendix can be irritated for a long time before someone actually goes and has an extreme infection. Now, to be clear, most of the time, the management for an appendicitis is surgery. That is very important. However, if it's a low-grade appendix and you're feeling right now it's tender, then definitely recommend my course. And second, I would say getting in to see a functional medicine or holistic medicine doctor, so MD or DO, to evaluate what can be done to reduce infection and inflammation in the gastrointestinal system. Obviously, that is much preferred if you recognize it. If you push on that line again and you're really feeling a distinct tender spot, you might be isolating directly to that appendix, and you can recognize that that is no good and the appendix needs some support because, again, it is a medical emergency most of the time if people go in for an appendix. Occasionally, that procedure will even need to be done open if the appendix has ruptured, and that is definitely a life-threatening situation. In some respects, the appendix could be imaged, and it may be that the appendix is slightly thickened or there's some inflammation around it. And maybe antibiotics could be supportive. The other concern with appendectomy is complications, particularly post-operative infection. So imagine, your appendix didn't just start hurting on day one. It probably was giving you symptoms for a long time. So indigestion, bloating, difficulty with bowel movements. All these things can be related to the appendix because, again, think about the appendix role is to protect the small intestine. So therefore it can be overwhelmed, right? And so I think about that, kind of in front of the small intestine establishment. It's getting overwhelmed and inundated with a lot of bacteria. The small intestine can be very inflamed very quickly if there's bacteria that's introduced or pathogens or even just general microbes that exist in our large intestine naturally that are not designed to be in our small intestine get in there. So this is important because post-operative infection is very real for the appendix. There's a very large incidence of that. There are some very specific microbes that tend to increase the risk for infection. So the ideal situation, in a non-ideal situation, is if the appendix is removed, it's sent to pathology, and then it's cultured and sensitivity right away, so that you know if there is any infection. So fevers, chills, nausea, vomiting, all those things you need to head right back into the emergency room, because that is really problematic and is very real. Okay, there's also concern for abscess, which is basically a persistent bacterial infection. So the difference is the appendix was infected and now the abdominal cavity is infected postoperatively, or there's an abscess of forms in the skin, particularly at the incision site, because of the nature of this problem, not necessarily because of surgical skill set, because an appendectomy is a pretty easy procedure by and large. The appendix has a kind of a worm-like shape. It sticks out like this. So most of the time what happens is once you get in there, kind of inspect the area, you basically cut off, like you basically like tie or occlude the appendix, and then oftentimes then it is just a matter of removing it. Now, when it is removed, you have to realize that there's still some interdigitation into the intestinal wall. So the appendix isn't completely gone, and otherwise you'd have to get into the intestinal wall. But it is macroscopically gone. However, not microscopically gone, because surgeons work on the macroscopic level, which is what they see, right? And so it is not possible with appendix nor tonsils to completely remove it. Now, oftentimes, though, it's very scarred and it's very reduced in size. So I have not seen imaging, nor have I explored looking for imaging to see its recovery rate. I don't really have any data as to how long it takes for it to regrow or things of that nature. And I don't know that actually happens in someone's lifetime. But doesn't mean that it's not going to be doing something for you even a little bit. And I think that's really important, a little bit for the appendix, but a lot more important for the tonsils. So again, there are a lot of roles of the appendix in small intestinal bacterial overgrowth, or SIBO. So the appendix is considered a reservoir for beneficial bacteria. You should know that. And it can be overwhelmed. When someone has an appendectomy, it does affect the gut microbiome's composition. And so there could be a post-appendectomy SIBO, and this might take years to manifest. All right, so obviously there's a tremendous amount of immune function in the appendix because of its protection of the small intestine. And then second of all, as I mentioned, the appendix didn't get inflamed overnight. So there's a lot of times that this has built up over time due to different triggers. And so that's something to consider, is none of those things have gone away once the appendix is removed. None of the good things are there for the appendix, but still the bad reasons why the appendix got inflamed are still there. So there's still work to be done after an appendectomy. All right, moving into the tonsils. So the tonsils, right, are like kind of little, like kind of round things that are seated kind of back here. They're supposed to be like, they're pink, they're supposed to be shiny and glistening and smooth, and then they have these kind of wave shape, so that their job is to protect what's going into your mouth, your nose. You have a lot of glandular potential space that could harbor infection. So the tonsils are the bouncer to the mouth. And that's a big deal because it's part of the gut tube, right? So everything that goes into our mouth goes through the gut tube. So we need a lot of an immune response, okay? So the tonsils can get overwhelmed. They have a huge job, right? It's all this area they have to serve as the bouncer. That's a big deal. Their job is to kind of collect, process, destroy the pathogens that are coming in through the mouth, the nose. And so that's very big. Sometimes they get acutely inflamed, and oftentimes that's strep throat. Okay. A lot of times people have recurrent strep throat because the tonsils are harboring those bacteria. Now, you gargle with salt water. Some people might take antibiotics. Other people might do a little bit different holistic approach. There are definitely some people who do cranial manipulation who can adjust the tonsils. Even the estheticians in my practice are trained actually to support the tonsils. The other thing I want to say about the tonsils is their role in some other problems in this band of the mouth, and I'll get to that in a minute. So we talked about acute tonsillitis, and then there's obviously recurrent tonsillitis, as I mentioned. So this is usually defined as 7 episodes in a year, or 5 episodes per year for 2 years. I can't even believe it. Or 3 episodes per year for 3 years. I have a very good friend who, as a child, kept passing out when she was running, and she was like 8 years old. So she was running, and then she just passed out. So it was seen to be asthma. Well, finally, someone looked in her mouth, and their tonsils had grown so large they had actually obstructed the airway. So she was exerting herself with running, and that was exhausting her system because she didn't have blood supply. She didn't have oxygen supply, rather, to her body. She, at that point, had a tonsillectomy. Now, that's definitely enlarged tonsils have airway obstruction issues, and that should be observed. There's also going from recurrent tonsillitis to then abscesses, basically because the bacteria is starting to win in that tissue. Some people can have those drained with a needle or a small incision. That is unfortunate that that's happening. And then tonsillectomy, of course, might happen if there's an abscess. But remember, just like the appendix, this is a much more longitudinal example to the appendix, is this infection is causing a significant problem. Yes, removing the infection will lower the infectious load, but what is the reason that the tonsils got this infected, right? That's with recurrent tonsillitis, abscesses, those are big deals. What is the reason that there was such an insult from the area that this very important immune organ that knows how to work, right? It knows how to pump and help destroy bacteria. It helps the immune system with recognizing problems. It's meant to be there. So why did it get overwhelmed enough? Now it's removed. And now in some respects, you have 2 problems because now you have no defense there and you still have the original infectious problem. Another area with stones is called tonsillitis. Now, I have to be honest, I was not really aware of this title until a few years ago because, I'm a gynecologist. And so, but that's no excuse, right? Because tonsillitis are actually like stones of crud, purulent drainage that have hardened and clumped. And now they have altered the tonsils and they live there. So instead of the tonsil being smooth and shiny and with these nice solid waves, like a really hardy structure, and now instead there are these kind of hard booger compilations stuck in the tonsils, and that makes the tonsil aggravated, it makes it dull, it makes it not able to pump or work at all, or very, very inefficiently. And it also is hard. So when the tonsils are hard, either with tonsillitis or recurrent infections that lead to inflammation, the tonsil is now more like a rock. Okay, so the first thing to do is obviously gargling with some salt water. I really appreciate silver spray as both prevention and treatment on the tonsils. 1 to 2 squirts in the mouth a day, and we'll get into silver spray instructions in a minute. The reason that I really like that is you can improve the integrity of the tonsils. but pressing on them or manual expression is what I say, actually can help displace the stones. It can help support the natural movement of the tonsils, and that can be very helpful. I definitely discourage tonsillectomy because you can manually alter, and you can also readily address it with, as I mentioned, silver spray and more oral health issues to help you. If someone's had a tonsillectomy, of course, they still have the interdigitations of the tonsils in the wall of the mouth. And usually I feel this when I do manual expression of the tonsils because they have grown back, but they're very scarred. So they're very adherent to the wall. They have limited function and they're much smaller. But this leads me to a function follows form issue, because if they're very large or they're scarred, they're going to decrease the ability of the area here to effectively work, right? So if they're really big, they might actually be causing some ear symptoms, like ears feel plugged, or they might be putting pressure actually on some cranial nerves, causing some symptoms in the ear. They could be contributing to sleep apnea. They could be causing jaw pain. Okay, they could be contributing to nasal and sinus congestion. So all these things need to be considered because the tonsils are pretty easy to address. When they're scarred, you're also going to have diminished function. Now they might be much smaller, but they're going to be a lot more adherent, which is going to limit the ability of these tissues to be able to stretch and be used to their appropriate capacity. What do I love to do about the tonsils? First of all, you want to recognize that the inherent problem could be related to your respiratory system. It could be related to your sinus tract. It could be related to some indigestion issues. It could be related to some musculoskeletal things like TMJ. It could definitely be related to oral health. So oral health is often ignored, right? So we're supposed to brush twice a day and you hopefully use your water pick and you floss and things like that. So they're all really important, but you have to realize that every day there's huge bacterial overgrowth in the mouth. And then that has to be reduced before getting down into the system. And that you can often see in stool test evaluation, actually, with things like Staphylococcus, Streptococcus, Bacillus, the bacteria for hand, foot, and mouth. So anyway, those are all things that get into our mouth that we actually can see have overgrowth in the stool test. And so those are very important considerations, because I like to say, fight the battle before it gets into the gut. So, and before it gets into the esophagus, preferably right away. And so if the mouth has infections, inflammation, if there's problems with the swelling of the tonsils or the inefficiency, if there's sinus drainage, all those things can really inhibit the gut and the rest of the body. So the silver spray, as I mentioned before, is really important to help it helps to oxidize the bacterial membrane. So it helps to kind of disintegrate the bacterial membrane, and as a result the bacteria can lyse or die, right? And then they don't have any activity. So that's very good, and that's often the issue that the tonsils are facing. So we want to put silver spray on, preferably starting with one spray on each tonsil. Now when you use silver spray, you can't have anything to eat or drink 15 minutes before or after, because you want the oxidation effect to go to the tonsils and not to go to what you just ate or drank. Okay, so I encourage people to either leave it by the toilet or leave it in the car. The silver spray that we have, I think bar none, I've used it clinically. I've seen a lot of other people say, well, I have silver spray and I haven't seen the benefits because the parts per million that are in this are very effective. It's a very effective silver spray. Some people make their own silver at home, a colloidal silver, and kudos to you. But I really appreciate how this silver spray works, because I've seen it work so many times effectively in the clinic, and I've seen other ones be extremely ineffective. So I can't speak to other companies. I can't speak to any of that. I can speak to the benefits of using the silver spray that we have on the tonsils. If you have an active, severe oral infection, you want to go really slow, even with silver, because meaning one spray even on one tonsil once a day. Because if you start fighting an infection, because silver spray will help with that, it can be overwhelming. And I have seen that happen with our silver spray. So it's better to start slow and build up to 2 sprays on each tonsil twice a day. Again, put it somewhere, you get done with work, you get in the car, tonsil, 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 tonsil. And in the morning you go to work, tonsil, 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 tonsil. And that way you're getting that in, and it's protecting your entire system throughout the entire day. So it's also lowering your load. And that's very protective and wonderful. So immune organs that we discussed today, right? The appendix and the tonsils. Even if you don't have them, you still need to think about them, because if they went away for an underlying reason that wasn't addressed, if that happened when you were a little kid, then you might very well be having a struggle since before the time you had them removed. So that's when we get into the idea of mediators or long-term medical problems or diminished immune integrity, which can contribute to long-term problems. And that's just something we can work on, functional medicine doctors can work on to help you get better. Thank you so much. I hope you have a wonderful day.